We have done a lot of activities within the community by sharing food hampers that was received from different stakeholders, and also share information about COVID-19. The quarantine site was run from the mayor site and the clinic, local clinic. So some of the equipments that they requested from us, we assisted them with some beds. We gave them 7 beds so that the isolation or the quarantine site should be ready. There was people that were in the indigent list of the municipality where there is no income at all or little income to care for the household. But also from the NGO side, we work with different categories. We've seen it fit that we should also care for the child-headed household and the youth-headed household. Their parents are no more and there's no one who's caring for them. And we saw it fit that we should go during this time because we are receiving funds from SCAT and we've given to different community members. We have criteria that we are using when we give out the food. We cannot cater for all because we have limited funds. An assessment was done. For instance, if you get a grant, but you in the household, you are about 8. We shared that cost, but at times we find that, okay, the others, those are not qualifying, their debts are more. So we also looked at how we can cater for those people. And it was a very difficult situation because when we found that when we go out and give the food parcels at the household that were being identified, then we find that in that same street, people were telling that you've given this person, but this one didn't get. It gave us also time to look deeper into the criteria that we're using, but also it was also helpful because people could also assist us to say that you've left this household and the need is in that, and they shared their stories. Yes, I would say that the good point is like we managed to market ourselves. Peace Hermanas Trust, they work with DJ Marie Trust. They came to us, they were looking for NPOs that they can fund so that they should cover the social relief project within the area. And KSDF was one of the NGO that came out, and we were happy because even though the COVID-19 is affecting us negatively, but for the NPO side it was positive because at least people could say that we've heard that you are doing such a good work within your community. The mines worked with us because they felt that we know the community better than them. This was an eye-opener for us. We shouldn't just look like I'm doing the home-based care or a food garden. Look beyond that so that when such things happen like COVID-19, something that no one knew what would happen, but it happened and we had to do something. So we should look beyond what we are doing, and this will help us a lot to save our community. And also what I've learned, some of the issues that were not attended by our local government, they need to be fixed. I work directly with the clinic staff and they will tell you when they come from those people, how those people feel, but you cannot just give them the support from the health side. They also need psychosocial intervention.